Welcome to OAC Health Talks. I'm Joe Naglowski, President and CEO of the Obesity Action Coalition, and we are excited for you to join us for this educational series that dives deeper into specific health topics that we know are important to you and the OAC community. Health Talks are designed to empower you while providing straightforward, practical answers and insights from trusted experts. So let's dive into today's topic.
Hello, everyone. My name is Dr. Jonathan Stine. I just want to welcome you to today's program. My talk is entitled Liver Health and Obesity, Understanding the Connection. Now, as many who are watching today are probably aware, obesity is a tremendous public health problem. And according to the Centers for Disease Control and Prevention, or CDC, the most recent data collected between August 2021 and August 2023 shows the prevalence of obesity among American adults continues to be a public health concern. And in fact, overall obesity rates among adults is approximately 40%. So that's 2 out of 5 of your friends are going to be living with obesity. Now, obesity has a wide range of implications. It impacts nearly every part of the body. And this increases a variety of health conditions shown here on the graphic. This includes an increased risk of heart attack and stroke, greater rates of depression and sleep apnea, higher chances of reflux disease, skin fold rashes, kidney failure, infertility, joint pain, weakened muscles and bones. The list goes on, including many different types of cancers, and also the focus of today's webinar, which is chronic liver disease. But before we can talk about how obesity leads to liver disease, we should understand exactly what the liver does. Now, of course, in my opinion, as a liver doctor, the liver is the most important organ, but I'm biased, of course, so before I get ahead of myself, let's talk about why it is a key player in our body. So first, the liver strengthens metabolism. And in fact, it helps us metabolize carbohydrates, fats, proteins, and it converts them into usable energy and ultimately stores them in the liver in the form of glycogen. Now, your liver also metabolizes medications to make them more easily absorbed by the body. The second thing the liver does is it helps in detoxification. And in fact, the liver's primary function is to filter blood that arrives to it from the digestive tract. When the blood arrives, the liver filters out toxins, including drugs and alcohol, and it takes them from the bloodstream and breaks them down into substances which can then be eliminated from the body through either the urine or the stool. What else does the liver do? Well, it produces bile, and bile helps us to digest fats. Therefore, bile also helps us to absorb vitamins that are fat-soluble. The liver also excretes bile and controls the majority of the blood chemical levels, and ultimately this further aids the liver in removing wastes. The fourth thing the liver does is it stores vitamins and minerals and sugars. It also stores iron, which is essential for production of red blood cells and other functions in the body. The liver also plays a key role in the production and regulation of hormones, and this includes insulin and testosterone, which both play a key role in obesity. The liver also helps in blood clotting by producing substances which are essential, including various clotting factors and fibrinogen. And then lastly, the liver itself produces nutrients after it receives blood once it exits the intestines and the stomach. Now, pertinent to today's talk, the question is, at least to me, is can the liver be affected by obesity? And the answer is a resounding yes. And this graphic begins to help explain how this happens. And here we see 4 categories of individuals based on their body mass index, or BMI, and their metabolic health. Now, over time, as we gain weight, we progress from the lower left part of the quadrant and go from metabolically healthy, non-obese, to becoming metabolically healthy obese on the right. And if an unhealthy lifestyle persists despite our best efforts, we can then progress to metabolically unhealthy obesity and move upwards on the graphic. And this is characterized by metabolic problems alongside the high body mass index. And here we see greater rates of insulin resistance, poor adipose tissue function. There's also increased amounts of body fat, both under the skin, which we call subcutaneous fat, and then visceral fat, which is around the organs. And collectively, this leads to a much greater risk of both diabetes and cardiovascular disease. Now, pertinent to today's talk, fat accumulation in the liver is also very common in individuals who have developed obesity who are termed metabolically unhealthy. However, not all fat in the liver actually leads to problems, and there are actually several different types that we should discuss. Shown here on the screen is kind of an alphabet soup, if you will, of different acronyms. And the overarching theme here, which ties everything together with the umbrella term, is actually called MASLD. And this means metabolic dysfunction associated steatotic liver disease. And this encompasses everything in the box, and is characterized by excessive fat buildup in the liver. And this typically happens in the absence of other causes, such as excessive alcohol use. And again, patients need to have abnormal metabolism to have this. Now, under this umbrella, we see several different boxes. Metabolic dysfunction associated steatotic liver, or MASLD, is the earliest stage of this disease process, and it's shown here by the red section. This is characterized by fat buildup in the liver. However, at this point, it doesn't yet cause any inflammation or damage. Now, reassuringly, most people with MASLD actually do not have symptoms. And unfortunately, they may not know they have this unless it is diagnosed during routine imaging or blood tests, typically obtained for another condition. But there's good news. At this stage, this condition is reversible with lifestyle changes such as diet and exercise. On the other hand, that means if MASLD goes uncorrected, it can actually progress to the right to metabolic dysfunction associated steatohepatitis, or MASH, as shown by the blue section. So what is MASH? Well, individuals living with this progressive type of fatty liver disease have fat in the liver, and over time this has led to inflammation and liver cell damage. So not surprisingly, MASH is the more serious form of this disease, and over time this can lead to scarring, which we call fibrosis. However, MASH can still be reversed with the right treatment plan, and we'll discuss that in the upcoming slides. Unfortunately, despite best efforts, a small number of patients will still go on to develop cirrhosis of the liver, shown by the green section. From there, patients with cirrhosis are at risk to progress to decompensated disease, shown by the light blue area within the green box. What is decompensated cirrhosis? Well, it's basically cirrhosis with symptoms, and it's characterized by any of the following. 1, bleeding veins in the esophagus or stomach, which we call varices. 2, fluid in the belly, which we call ascites. Or 3, liver-related confusion, which we term encephalopathy. However, there's one more thing to worry about if you have cirrhosis, and that is an increased risk of primary liver cancer, which we call hepatocellular carcinoma, or HCC. This is depicted by the orange area, and unfortunately, the lifetime risk of liver cancer and cirrhosis is about 20%, so getting regular screenings is really important. And now that we've discussed, the different types of MASLD and how it progresses over time to fat in the liver, to inflammation, to scar tissue, to cirrhosis, and then its complications, the question is, how common is this disease? And again, we talked about rates of obesity, and rates of MASLD actually follow in parallel with this. And in fact, in upwards of 30% of adults in the United States, which means 80 million individuals, are living with this condition. This is shown here by figure A schematically. In figure B, we can see among individuals living with obesity, 4 out of 5 actually have underlying MASLD as well. This is shown by figure B. In figure C, we can see that if you have diabetes, a very similar story, where 2 out of 3 individuals with type 2 diabetes also have MASLD. And unfortunately, in parallel with the worsening obesity epidemic, rates of MASLD are projected to continue to increase. And in fact, by the year 2035, 1 out of 2 adults are going to be afflicted by this condition. So clearly, we need to work hard to try to improve this, and improving MASLD starts with weight loss. And did you know even a small amount of weight loss can significantly improve your liver health? This graph shows the powerful impact weight loss can have on MASLD. And in fact, research shows as little as 5% body weight loss can reduce liver fat and to begin to reverse liver damage. Ballooning and lobular inflammation, which are signs of liver injury, can also improve if you lose weight. And in fact, around 7% weight loss is enough to see real progress in reducing this inflammation. For patients who have MASH and liver fibrosis, about 10% weight loss can lead to disease resolution and also halt progression to the more severe liver conditions we showed on the previous slide. And even liver fibrosis or scar tissue can be reversed when you sustain body weight loss of 10% or more. So to me, this highlights how critical weight management is for liver health. And remember, even a little weight loss counts. Start small, aim for steady progress to protect your liver and your overall health. But where does weight loss begin? Well, it starts with making healthy lifestyle choices. And this graphic highlights 5 key lifestyle factors that contribute to maintaining a healthy liver and improving your MASLD. So let's go through each one of these simple but powerful strategies for better liver health. Step 1, eat a balanced diet. We recommend you consume plenty of fruits, vegetables, whole grains, lean proteins, because these are essential for liver health. In fact, foods such as broccoli, spinach, and berries are rich in antioxidants and nutrients which help support some of the liver detoxification processes. On the other hand, avoiding foods that are high in added sugars, saturated fats, and that are processed or ultra-processed is important because these can independently increase the amount of fat in your liver and ultimately over time lead to damage. Step 2 is to stay active. Regular physical activity helps burn fat. It improves insulin sensitivity, and both of these reduce fat buildup in your liver. How much should you do? Well, you should aim for at least 150 minutes per week of moderate intensity activity. This includes things we all like to do, such as brisk walking, light cycling, or even swimming if you have access to a pool. And remember, if you feel up to it, you can always shorten this time to 75 minutes per week if you perform more vigorous intensity activity. However, you don't have to start with intense workouts. Every step counts. And in fact, for every additional 2,500 steps you take each day, your risk of MASLD goes down by 20%. Step 3 to a healthy lifestyle is drink coffee. In fact, 3 cups a day of black coffee has been shown to lower the risk of liver disease, including MASLD. How does this happen? Well, coffee actually contains compounds that reduce inflammation, and they may help prevent liver scarring. These compounds include things such as polyphenols, so it's not always about the caffeine. Remember, avoiding excessive amounts of sugar or cream to ensure you get the most benefit out of your 3 cups a day of coffee. Step 4 to leading a healthy liver lifestyle is to avoid excess alcohol. And excessive alcohol is one of the leading causes of liver damage. It can accelerate the damage from the metabolic component of this condition. And what exactly is excessive alcohol intake? Well, it's defined as more than 1 drink per day for biological females and 2 drinks a day for biological males. However, if you know you have liver fibrosis, it's best to avoid alcohol completely because adding this is like adding gas to an open flame and your liver disease will surely progress. The last part to leading a healthy liver lifestyle is to quit smoking. If you are, smoking introduces toxins, which can further increase inflammation and oxidative stress in the liver. So quitting smoking improves liver health, but it also reduces the risk of many other cancers and chronic conditions. So, in summary, a healthy liver starts with simple daily habits: what you eat, how you move, and what you avoid. And remember, even small changes, such as adding more vegetables to your meals or taking a daily walk, can have a tremendous impact over time. Prioritizing your liver health doesn't just protect this vital organ. It supports your overall well-being, and it helps prevent other diseases. And remember, you don't have to do this on your own. Your health is a partnership, and every important conversation with your doctor can make a difference. Remember, MASLD affects millions of people worldwide, and it's linked to metabolic factors including obesity, diabetes, and high cholesterol. Early detection is key, and this is incredibly important because, again, most people do not have symptoms of this condition, or they're relatively nonspecific, meaning there's no one symptom that tells us you have this. So go out there, start this conversation, get screened, talk to your primary care provider, get your annual liver test, especially if you're over the age of 35. And remember, our practice guidelines do recommend that if you have a first-degree family relative who has metabolic dysfunction associated with steatotic liver disease or MASLD, that you should get screened. Once you're screened, the type of liver disease will determine if you're referred to a specialist or not. Most specialists are engaged in this type of care when individuals have some form of liver fibrosis and they have MASH. So again, this is the type of this condition which is going to progress over time. And your specialist can talk to you about some of the lifestyle factors we talked about today. They can refer you to an exercise professional to help you increase your activity. They can refer you to a dietitian to help counsel you on nutrition. They can send you to a behavioral psychologist to talk about what motivates you and what makes you you. Everybody has different reasons why they do things. They have different things they enjoy. And if you can figure out how you tick, you're going to be more successful in the behavioral component of leading a healthy liver lifestyle. What else can your healthcare provider do? Well, they may suggest starting medications, and medications can help reverse liver damage. There are recently FDA-approved treatments which are now available. About a year ago, we couldn't say this with good confidence, but we have at least one medication now which the FDA has given conditional approval, and your healthcare providers can tell you more about this. And remember, they can also ensure you get proper testing and monitoring. Right? Once you're diagnosed, we need to make sure that you don't progress, that you don't get worse, that you don't develop cirrhosis, and that your care plan is working. And your specialists are going to know exactly what are the clinically meaningful targets. They're going to want to reduce the stiffness in your liver by a certain amount. They're going to want to reduce the inflammation, which they see in your blood work, by a certain amount. And again, remember, we have those weight loss goals that we talked about, which they can help you with. So again, don't hesitate to start the conversation. Ask questions, get interested, share your symptoms, look for support groups, and even just mention your concerns to anyone who will listen. Will empower you to take control of your health. So once again, I'm Dr. Jonathan Stine. Thank you so much for stopping by today to listen to all things related to obesity and the liver, and then our discussion about the most common cause of chronic liver disease worldwide. If you're looking for more information regarding this condition or just want to connect, I can be reached in any of the following manner here on social media. And with that, thank you so much for your time, and I hope you have a lovely day.